Hi, this is Dr. Duresti with the Cranial Release Technique, and I've been getting a lot of questions about how can affecting the cranium with a technique like Cranial Release Technique change everything else down below. And I wanted to just spend a few minutes just doing a little review. So, as you've seen before in my videos, we have the plastic model of the skull, the 22 bones that make up the cranium. And the tendency is for these bones, well, normally they should be balanced, they should be aligned. And of course, as you've seen before from my other videos, they are moving. And they should be going through this breathing or this respiration process very gently, nice and smooth. But the tendency is that the bones tend to shift, they misalign, and that misalignment now interferes and causes this breathing ability, this respiratory mechanism to be labored, to be harder than it should be, to be under stress. So if we go back to the plastic model, when these bones shift and misalign, instead of thinking of the cranium as one bone misaligned, or this bone misaligned, or that bone misaligned, let's think of it globally. All the bones have shifted. As those bones shift, that stress pattern ends up here at the base, this blue bone in this model. That's the occipital bone. And that's where the first bone of the neck, the atlas, sits. So as the cranium shifts, the occiput shifts, misaligns. That then causes the atlas to misalign. The body's going to compensate in the second cervical and the third and the fourth. And all the way down the chain to the pelvis is going to be in a misaligned, distorted position because of the distortion of the cranium. Because of that, the pelvis will misalign. When the pelvis misaligns, the leg lengths will change. There'll be muscular imbalances throughout the body. And so from a musculoskeletal standpoint, a cranial distortion virtually affects everything down to the feet. Even I've seen the arches of the feet, which should be, if I put my hand this way, the arch to give you support. When some people come in, their arches are flattened and weakened. With regular cranial release technique, I've seen that arch return. So amazing things happen when you take the stress off the cranium. Okay, so that's the musculoskeletal system. The muscles, the bones, the tendons, the ligaments, the fascia. Remember, inside the cranium, we have the brain. So with that cranial distortion, I don't think the brain could be happy because of those walls sort of closing down on it and causing actual mechanical stress on the brain, the central nervous system. And that's the computer that's running everything else in the body. So then when patients come into me and they say that they have digestive disorders, hormonal imbalances, neurological issues, skin trouble, weakened immune systems, all the things that I hear over and over and over, and you start to address them at the cranium by unwinding and rebalancing and allowing these bones to move again the way that they should be. And for example, my brother-in-law, who always had a lactose intolerance trouble, he loves ice cream, can't eat ice cream, can't drink milk, no dairy. And I remember when I first introduced the concept of cranial release to him, and he told me that, and I said, how long you been like that? And he said, oh, years, I don't even remember. I said, well, Why don't you get on the table? Let's see what happens. I gave him one CRT, one. And I said, let's do a few over the next week or 2 or 3 and see what happens. But of course, as soon as I left, he went and got ice cream to test it. And he reported to me the next day, the ice cream didn't bother him. It didn't give him the gas, the bloating, the colic, the pain. So how is it that balancing the cranium and restoring this mechanism can affect things like digestion, like skin, like bowel function, like upset stomachs, all these different things? Well, you're at the central core of what makes us us. You're at the central nervous system. When you affect the central nervous system, when you remove stress and tension from the central nervous system, only good things happen. Only good things. That's why the real message is for everyone to receive cranial release on a regular basis, myself included. So the website is cranialrelease.com. You can search for a practitioner in your area. If you are a practitioner and you're thinking, gee, maybe I should consider adding cranial release to my practice. Maybe this is something that my acupuncture patients would benefit from. My chiropractic patients, my physical therapy patients, my dental patients, my medical patients, my naturopathic patients. We go on and on and on. If you're putting your hands on a patient to do some sort of therapeutic work to help their body function better, and you're not including the cranial release technique, I think you're missing the main player in the game. There is a button on the website for practitioners that says online training program. And if you click that button, that will take you to another page and you can learn more about how you can learn the cranial release technique, everything that I'm talking about here, everything that I've put together in the package for you to have, for you to study, for you to be able to take into your practice and do this work successfully. It's all at cranialrelease.com. This is Dr. Duresti with the Cranial Release Technique. Thank you so much for watching. I hope you have a fabulous day, and I hope to see you down the road soon. Goodbye, my friends. Adios.